Yes.
Now I'm recording. Now I wonder if I can make you the host. Where was the option to do that though? I don't see an option to make you host again.
Oh, if you click on my
I see it.
on the dot.
Okay, so you're the host again. I am still recording.
Okay.
So that's probably, and I guess we can do the same with if we want Sandy or whoever jumps in, just make her host, just have her start recording and then switch it back to you. Because you probably want to be host, right?
I don't have to be. The thing about making co-hosts is they can monitor and mute people. Otherwise, only I can do that. But I'm going to be, driving the presentation and.
Yeah. That's interesting. I don't know. Maybe when Sandy jumps in, there will be a.
I just messaged Joint Tech.
Okay, yeah, I'm just kind of clicking around in here, but I don't see any options.
Hi, Jana. Hi, Dr. Zamora.
Hello.
Can you all see the presentation, Mike's memo?
Yes.
Okay.
Yep, I see it.
Mike, Sandy Co-Simmons says if I make you a host, then that means you are co-host.
Okay. Let's try it again. Okay. Now, do you still have the ability to do what you need to do? I mean, I see you're still recording. I'm recording.
And you all can see my screen, right?
Yep.
Okay.
And then I've got the ability to mute and unmute, it looks like.
I don't have the ability to mute and unmute if I make you the host.
So yeah, you've given up all host abilities.
Mm-hmm.
Worried about. Well, I'll be here. I mean, I'm happy to to monitor that, and if anyone jumps in, to mute them and to try and pay attention, unmute them.
I just wanted to test my microphone. Can y'all hear me okay?
Yes, Leonard, we can hear you.
Okay, perfect. Thank you.
Okay. I'm going to mute myself. My kids are making a racket.
Okay, good morning. Are we ready? Okay, good morning. Today is October the 14th, 2020, and is now 12 noon. As a quorum of the subcommittee.
Excuse me, Manager Jones, Chair Jones, I don't see Manager Valadez yet.
You need her on, I agree.
I'm going to send her a message right now.
For those who've just joined us, we're waiting to see if our other member of our subcommittee is going to join us here shortly in order to have a quorum. Mr. Duncan, given that the chair of the Strategic Planning Committee, of which we are a subcommittee, is part of the meeting today, is it possible that we could proceed if we don't get the other member in her absence with him as a voting member?
Let me take a quick look at the bylaws, and I will get right back with you on that. I think that may be possible. Give me just a moment.
Okay, thanks very much. I appreciate it.
I've tried sending Manager Valadez a message and calling her. She's not responding.
Chair Jones, under 7.4 of the bylaws, a committee is allowed to perform any of its designated advisory functions by constituting any two of its members as a subcommittee. It's my opinion that Chair Bell, Dr. Bell, could name himself to the committee temporarily in place of Manager Valadez, so you could get the meeting going.
Dr. Bell, would you be willing to do that?
Yes, Chair Jones, I would like to allow myself to be a member of your subcommittee so that you will constitute a quorum.
Okay, thank you very much. Appreciate that very much. That will allow us to proceed with our meeting. Having said that and having received that request, I'll go ahead with our start. Good morning, good afternoon. Today is October the 14th. It's now 12:04. As a quorum of the subcommittee is in attendance via our video conference, I would like to call to order the meeting of the Central Health Eastern Crescent Subcommittee. The first item of business today is public communication. We will receive public communication for both the Eastern Crescent Subcommittee and the Strategic Planning Committee before we proceed to our subcommittee agenda. Members of the public who wish to make comments during the public communication portion of the meeting must be registered with Central Health via online form or by telephone no later than 10:30 a.m. today. Jana, did anyone register to make comments today?
No, Chair Jones, we don't have any members of the public sign up to speak today.
We have no members of the public to make comments on either the Eastern Crescent or the Strategic Planning Committee. Is that correct?
That's correct, sir.
Okay. With that said, then we will now proceed to the subcommittee agenda. In the interest of keeping this subcommittee meeting to 1 hour time limit, presenters will be given a limited amount of time in which to present and answer questions. And I will monitor the time for questions and answers as well. Additionally, we will have the agenda slightly out of order. Items 3 and 4 will be taken up together before item 2. With that said, I would like to review the minutes of the August 12th. Item 1, review the minutes of the August 12th and September 10th meeting of the Eastern Crescent. Can I get a motion to approve the minutes?
Chair, I move the approval of the minutes of the August 12th and September 10th, 2020 meetings of the Eastern Crescent Subcommittee.
Second.
Have a second. Been moved and properly second that the minutes be approved. Any objections or abstentions? Not hearing any, we'll go ahead and approve those. We'll go to our next items, and as I've indicated before, items 3 and 4 will be taken together. Item 3, discuss and provide direction on process of healthcare delivery planning, design and construction, and community engagement for interim and long-term facilities in Eastern Travis County. Item number 4 will receive and discuss an update on the staffing and relocation of the Resource Center from Balmer-Overton Elementary School to Barbara Jordan Elementary School. Mr. Mike Giesland, Ms. Stephanie McDonald, Ms. Melissa Cepeda, and Ms. Rachel Hargey will be presenting. These items should be concluded in 30 minutes, if at all possible. That said, I'll turn it over to Mr. Giesland.
Yes. Thank you, Chair Jones. Thank you, members of the committee and public for joining us today. I'll be brief. There's a cover memo that is in the packet that I will not speak from verbatim, but I will hit the high points as noted in these discussion prompts. Late last month, we looked at what was possible with respect to the Hornsby Bend site in terms of being able to turn dirt. And I use that term liberally to mean any number of construction activities. Realistically, though, I think what we're looking at is getting the geotechnical engineering started, and as well as, and I'm advised as part of this meeting, that the architectural and engineering task order issued so that we can begin putting together the site development plan. With the site development plan, that opens up a lot of opportunities in terms of being able to commence with the work around designing and constructing a larger health and wellness center. I'm skipping over a lot of steps, but just again, trying to summarize where we are. Second, you will have this January project plans and budgets, and these will be preliminary and subject to change as conditions change, but it will give the committee, the board, the public a sense of here's the overall project plan and here's what the budgets are. And then obviously as conditions change, either adversely or positively, hopefully, then we'll obviously change those plans and budgets accordingly. You will receive in December a mock-up of what this will look like. So that way the committee and the board members can opine on, yes, we like this format. It's something that we're accustomed to, and it's something that we can follow along. Third and lastly, we are working with our partners at Community Care with revised pro formas. This takes different terms. You'll hear pro formas, you'll hear site refresh, you'll hear financials. I'm lumping them all into the same bucket, but essentially it's making certain that we understand what their service delivery plans look like, not only from a line of service standpoint, but also what it looks like financially, so that the way the board can be advised on the additional operating costs should service levels change or the board desire a different type or certain type of service. or in working with the community, what that would look like. And again, those will be, I'm advised that those will be available by November. That concludes my initial remarks.
Manager Jones, I'd like to move into some work that Rachel Hardigree has been leading around non-clinical services and her process, as well as how she is using a social determinants of health framework to investigate and explore which appropriate services would help improve health outcomes in our 3 priority areas. And then after that, I will ask Melissa Cepeda to walk through where we are at in terms of partnerships for the Overton, the relocated resource center when it moves to Jordan Elementary, and an update there. So Rachel?
Hey, great. Good afternoon, everyone. Within the backup packet, there are 2 sections that I'm going to be referring to. The first is termed the ETC non-clinical program social services planning process. And then the second is the non-clinical services strategy map. These are sort of colorful pages within your, there we go. Thanks, Perla.
Can you see them? All right.
Yes.
Just let me know when to turn the page.
Got it. Thank you. Appreciate that. Okay, so I'll try to keep this as brief but substantive for you all today. So we began the planning process with preliminary planning discussions with partners and stakeholders, and sharing that information with the community via advisory committee discussions. And then these discussions will continue throughout this process. And again, this is just a very high level overview. And then next, reviewing and analyzing both historical data, which might include the community profiles that have been compiled previously, and also current data, including our recent demographic report and the health risk assessment data, or HRA data, from community care to glean information regarding social drivers and indicators of health within the community. And so just to touch a little bit more on this HRA, we had discussed this, I believe, at the last Eastern Crescent Subcommittee meeting. The HRA is administered by CUC to all patients annually during an encounter, and the analysis that our analytics and reporting team has undergone or concluded just recently, the purpose was to understand how transportation, food, and medication needs vary by geography and location. Additionally, the analysis sought to understand the correlation of self-reported issues with transportation, ability to pay for food, and the ability to pay for prescriptions with the person's own perceived perception of health. And so that analysis included over 90,000 HRAs evaluated over a 4-year period, which will be used. The intent there is to tease out specific data elements and information or services that would be most beneficial within the community based on unique community attributes to inform the non-clinical service planning, while also taking into consideration the various social determinants that impact the health of our population. All of these data and information will be used to align services based on needs and identify and engage with partners and programs to inform the non-clinical services to integrate into the overall service profile, which is similar to sort of with the clinical planning process that we've shared previously and is reflected in this process map we're looking at now. So the next page, Perla, please. Moving on to the non-clinical services strategy map in the backup packet with the colorful highlight boxes at the top, understanding that an estimated 80% of health is shaped by factors outside of the medical setting, we felt that it was really important, imperative, that we incorporate a framework or strategy map to illuminate what affects health based on the social determinants of health model that's presented here, which I think most people are pretty familiar with, which is highlighted there at the top with those colorful boxes. So understanding that the social determinants are quite complex, there's no single framework that includes everything, but this draft is our map that we're using to guide and ensure that our planning efforts address the social determinants that we can impact through our mandate, through various strategies and program offerings. So these strategies will be evaluated for effectiveness via select indicators you'll see on the left-hand side of the table, with the ultimate goal of improving health outcomes for our population. This is also a living document that we intend to update as we progress through the planning work and also into the future. So it's a living document. The white boxes essentially we can customize based on various locations and communities, and also incorporate natural change and growth that will occur in these communities over time. And so that is really my highlight for the overall process and how we intend to integrate our strategy map for including the social determinants for the non-clinical program recommendations. And with that, I will turn it over to Melissa.
Melissa, are you going to walk through kind of how we've used this framework and applied it to the services and partners that we hope to bring to the relocated Jordan Resource Center?
We are looking at new ways to promote the wellness and link our patients to additional resources and services within the community, such as transportation, food. We often see these in silos, but socioeconomics, housing, food, education, they're all intricately connected to health outcomes. And we are looking at strategies that will involve collaborative partners as catalysts for change and share a common purpose. More time will be needed to determine some of the wide-scale social impact of implementing these strategies around indicators. And on your screen are some services that are being considered for Colony Park. And these partners have been identified. And when I say Colony Park, it's the Northeast Resource Center. These partners have either been identified or have expressed interest in providing services to this community. And you will notice that some of the indicators have overlapping needs, such as healthcare coverage, needing transportation to a medical appointment, or identifying a medical home. And the first one is around housing. 211 service calls demonstrated a need for legal aid. And currently we do have this at Southeast Health and Wellness Center that you may be familiar with. And a lot of legal aid can really hit all of the domains and social determinants of health, such as, income. You can appeal for denial of food stamps or benefits or disability benefits. It goes to utilities, around housing, preventing evictions, education and employment, enforcing workplace rights. So it really hits on a lot of different domains within social determinants of health. Another one is Austin Area Urban League, providing some emergency and critical repairs to that community that address some, substandard housing conditions. And it really goes through 3 different approaches through their housing pillar. And another one is providing some ESL classes. When we look at the demographic data, there's a high number of Spanish-speaking individuals in this community. And so we wanted to offer that as a resource. And Perla, if you want to go to the next slide. So for these strategies, I'm exploring multi-pronged approaches and established referral pathways between the partners, which you'll see below in the next indicator, which is infant outcomes and infant mortality. 211 service calls demonstrated a needs that presented a need for prenatal care or healthcare coverage or needing transportation. It all is tied back to those infant outcomes. So we have Black Mamas, ATX. They provide prenatal and postpartum services to women. And then Austin Public Health, they have a new WIC mobile unit that they will be deploying to this community and providing those services. And then we recently partnered with Austin Diaper Bank to provide families with a supply of diapers. And then lastly, child seat distributions and inspection installation of those car seats.
And Melissa, if I may just interject, we have received proposals from, for example, Black Mamas ATX and the Austin Urban League. We're trying to evaluate all of these proposals and see what makes them best fit for the space that we have. And then the Austin Diaper Bank, we've been approved to be a partner. We have not determined how those diapers would be distributed and the resources that they provide. They provide resources in addition to diapers, but we have been approved as a partner, and thanks to Melissa's work on that, I just wanted to clarify where we're at in these services.
Thank you, Stephanie. So the next one is preventable hospitalizations. And this one we have medical coverage through our eligibility enrollment assistance at Central Health, and to explore partnership opportunities for transportation. Transportation barriers include a lack of vehicle or inadequate public transportation. So that is an option we have. We have done pilots previously, and so I think we would just want to look at that data and see what the outcomes of those are to implement a new strategy in that area. And the next slide, please. The next indicator is around chronic health cases. 211 service calls demonstrated needs that present a barrier to managing chronic conditions such as diabetes. Once again, healthcare coverage, transportation. This is where you see some of that overlap in some of these areas. And for diabetes resources, there is a 6-week class that Austin Public Health provides in English and Spanish. And really it's a healthy living, physical activity. It teaches you how to shop at a grocery store, with this chronic condition. And then prescription assistance, that's something else that we would want to explore for MAP and MAP Basic. I'm not sure if we have anything in place right now, but that was one of the indicators as a need. And then of course, case management, wraparound services with Central Health. And then the next neighborhood level indicator would be food insecurities. This is one of the top, food security is one of the top common social determinants of health that we hear a lot. And through this pandemic, I think those needs have definitely increased. Our patient population finds it difficult to obtain food, either due to geographic or could be financial barriers that limit patient access to nutritious foods. In either case, food insecurity can lead to those chronic conditions such as diabetes. So Central Texas Food Bank is another partner that has provided a proposal to provide some SNAP eligible assistance along with some other programs. And this would be done virtual. A lot of these services are either virtual, in person, it could be a hybrid of both. Some of the classes that you'll in this presentation, some are synchronous, asynchronous, or a combination of both. So really it gives our patients an option to receive these services. Another one is the nutrition education, which is similar to Austin Public Health. It's through their SNAP Ed funding and obesity prevention grants for individuals that are SNAP eligible. It's a 7-week program in English and Spanish. So really building in that referral pathway. Once they've enrolled in SNAP, we can do a referral in for them to take these classes. And they cover an array of different topics, which is included in this, and also teaches, the basic culinary skills that, some individuals may not have. And then providing access to pediatric resources. Once again, WIC, I put in there because there's nutritional education component to that whenever they're mixing formulas that may have an impact to how much formula they're buying or how much, that sort of thing. So I've overlaid that service on that one. And then of course we have Farm Share Austin, which has been historically providing some services at the Barbara Jordan location in Colony Park. And during the pandemic, they transitioned those services to a curbside delivery. So right now they are actively doing that, and it is still available to those residents. And then lastly, if you want to go to the next slide.
You're running short on time, so if you all could sort of.
I am done, Manager Jones. The last piece is just some seasonal stuff that you'll see in some neighborhood centers.
And in closing, I just wanted to acknowledge Melissa's work and having a lot of these conversations. We have received word from AISD. They are managing the contract to move the portable from Barrington Elementary to Jordan Elementary. All indications are that it is still a go. They have received a permit from the City of Austin to relocate the portable. We have received word that they expect all of the work to be in place by mid-November. Is that accurate, Melissa?
Yes.
So that is our update.
Okay, thank you very much. That was very informative, a lot of very valuable information. We don't have a lot of time. You did both. I have, so item 3 and 4 was completed together. Is that correct? Mr. Giesling, you're.
Yes, sir.
Okay. I guess my question is, well, my questions are more for item 2, so I'll wait to item 2 before we get to that. Any questions from our board members on 3 or 4?
I do.
Okay, welcome, Member Valadez. We're short on time, so if you all can make it quickly, I'd appreciate it. Go ahead.
Okay, so first and foremost, I want to make sure that this is a living document that can be added to and modified or changed as we move along. Is that correct?
Absolutely, and I want to be very clear on the work that Melissa laid out. These are potential partnerships. We are still in active discussions with many of these groups.
I would like for y'all to consider adding the Meals on Wheels program, because they're all over the place. And the work that they have done with respect to housing repairs, et cetera, has been very, very good, excellent. And also Any Baby Can. Any Baby Can has a history of working with our community, especially those that have issues with children 0 to 5. Okay, so please consider working with them. If I need to make phone calls, I will, but I have worked with them in the past with both the agencies.
Absolutely.
Okay, and also with respect to Colony Park, I saw that there was the Black Mamas only targets Black women, is what it said there. And so I'd like to know, what organization are we going to use to address the needs of the Latina community and the Spanish-speaking community, not only there in Colony Park, but everywhere in our Eastern Crescent, since we know that that's the majority of the population. And also,
Manager Valdez, we're
with respect, one last point that I wanted to make, and that is with dealing with the what was that? The identification. The identification of those that have a medical history and a generational history of chronic illnesses. How is that being identified, or do we have CUC doing that? Do we have case managers that are going to be doing that, under part of our navigation team? That's it.
Okay, can you respond rather quickly?
We can absolutely explore all of those things. And the last point, we are still kind of developing how we can integrate the services and non-clinical services to improve health outcomes. And I think that's work that's going to stretch on for a period of time.
Okay, one last one. I was just looking at
Manager Valadez, I've given you the opportunity. We need to go on to other persons, so we have a lot of agenda, and unfortunately,
I understand.
So if I could make a comment, please.
I was about to go to you, Chair Greenberg.
Thank you. I know you're short on time. Just 2 quick comments. One, I want to thank staff for the tremendous work. This is just excellent. I know all the research has gone into this. I understand it'll be a living document, of course, but the matrix that you've provided and all of the information, just outstanding. And number 2, to say that we are committed to serving the entire, as a board and all of the community and all of those who so much need our help, who are under-resourced. So thank you.
Thank you very much. Manager, I agree with you, Manager Greenberg. I think your point was well taken. This is community-wide, recognizing that we have disparities within groups. We are focusing on targeted as we identify them. Manager Masaitis.
Thank you. Thank you all for the presentation. As you know, I'm always advocating to addressing the health needs beyond the clinical walls. I have a question. I'm not sure if this has been addressed in the past. I think you're being very ambitious in tackling all these issues, and I want us to pause for a moment and think about terms of feasibility, accountability, and sustainability, all those three. And rather than going broad to select a few high priorities, I've always heard about transportation as an issue and do it well, rather than stretching ourselves very thin. And this needs, do we have a dedicated person who is leading this effort? And this is a lot of work, and working with community partners and really addressing the capacity they have. So I'm really concerned. I like the work, but I'm really, as a person who's working in this space, I want us to pause for a moment to see what's feasible, what's not. I just don't want it to look pretty in the on paper and that we're not able to execute. And that is really my concern that I have. I want us to do it well. We can just address one issue and do it great. It can have a tremendous outcome on our population that we are serving. Thank you.
Okay. That's a great
Chair
question.
Jones, yeah.
Let me respond first. That's a great question, Manager Masai. Mr. Giesler, I'll call upon you to respond if you can make it quickly.
Yes, sir. Thank you. So short answer is yes on feasibility. You have an entire team of people that is working on this. And I think what's important is that we stick to what you just saw earlier, which is our program design. And as long as we follow that feasibility and that sustainability is part of that equation as we're working with these partners. And so to the extent that it looks like it's a little bit shaky, then that's when we come back to this committee or ultimately the board and have those conversations.
But the concern that I have, if I may just share, is that the funds it's not coming from us, Central Health, it's coming from partners. And that is a big concern that I have in terms of sustainability. And we can't be solely dependent on these partners without putting in money. So as a person who's working in this space, believes in the space, I have some concerns about this project at this moment. Thank you.
Okay, I think that what we'll need to do at a future meeting in which we have a time just to devote just for these activities we're talking about. And so we'll work on scheduling a time in which we can just focus on these activities we're going to do in the community in order to give adequate time to address the issues that was raised. Can't do it today, but I think the staff are giving a great update and an overview of where we're headed, and I think it's to be commended for the work you've done. I just like to one comment before going on to the next item. Mr. Giesler, in your presentation, I didn't hear a lot about the community facilities activities. Can you spend just a few moments talking about where we are on those so that our community members will be mindful of that? Of where we are in terms of timelines. So we have spoken both about the Colony Park as well as Hornsby Bend. Can you speak to that?
Yes, and so in January, we will have project plans and preliminary project plans and preliminary project budgets. And so that way you can see both at the committee level and the board level as well as publicly, here's our estimates for the timeframes for building the facilities and what the cost will be. Concurrent with that, you will also have refreshed, prior to that, actually refreshed pro formas of financials on from the clinical partners as well, so you can see that aspect of it. With respect to what I would say is maybe a visible presence, whether you're talking about Hornsby Bend or Colony Park, each site or Del Valley, each site has its own unique set of circumstances, but for Hornsby Bend in particular, the goal is to get the site plan approved, and that opens up a lot of opportunities in terms of being able to move dirt. Prior to that, though, I think you're looking at the geotechnical engineering services, and somebody correct me if I'm technically incorrect or not characterizing it properly, but the geotechnical engineering services and the architectural and engineering in order to be able to complete development of the site plan and get that filed.
Okay, so I want to make sure I'm clear on this because I think community needs to be clear. It is not reasonable to expect that we will see any dirt turn at the Hornsby Bend particularly, and certainly not Colony Park, and I doubt Del Valley before the end of this year.
I would say that's correct. We still need to complete the land purchase on Colony Park.
Okay.
And that's in conjunction with the city.
Okay. As it relates to Del Valley, where are we on that?
I'll defer to staff. I know I saw Mr. Lamp or Stephanie or Rachel Taranjo.
If I can, I'll just add quickly, we did execute a task order for geotechnical engineering work on the Del Valley site. So they will be going and digging soil samples. And last night, Rachel Taranjo and I reviewed the scope for the architecture and engineering services required for Del Valley as well. So we have multiple task orders that will be either that have been executed or will be executed this week.
Okay, thank you very much. And then on Hornsby Bend, so we have a facility out there that is operating at, from my understanding last our conversation, not at capacity. We have shared with the community our anticipation of doing something out there by the end of the year. All of you are aware, we're concerned about making sure that we keep as much as possible. So I'd like to, in the next presentation, talk about what are we doing to, one, educate the community about where we are on that area, and particularly what are we going to do to increase capacity at the current facility that we have. And so hopefully we'll have the opportunity in the next presentation, item number 2, to talk a little bit about that. Is that a fair assessment? Would that help us, do you think, Mr. Giesland?
Yes, sir.
Okay. Okay, let's go on to item number 2 then. And hear from community, from the our community outreach efforts. Mr. Ted Burton, Edwin, and Evans will be presenting on this. Also, Lorna Dominguez.
Thank you, Manager Jones. Hi there. This is Ted Burton, Vice President of Communications. I'm going to be sharing my screen with you, a screen that keeps going out. So I hope this works during this entire presentation. Okay. Can you see my screen now?
Yes,
we can see it.
Great. So joining me today for the presentation, as you mentioned, Manager Jones, is Edwin Evans, our Outreach and Enrollment Coordinator, and then from Community Care, Leonor Dominguez. She's the Community Care Community Relations Specialist. We're going to provide you with a brief update on our marketing and outreach efforts for the Hornsby Bend Clinic. The goal of our efforts was to reintroduce the Hornsby Bend Clinic Health Center using outreach, direct mail, paid media. As you may remember, the Health Center opened in February 20 of this year, which seems like a lifetime ago, but we had a grand opening event, and the community helped us plan the event, and we had media coverage, and it was a great success. And then a couple of weeks later, the COVID pandemic began, and that clinic temporarily closed. And so our goal is to reintroduce the clinic to the community, raise awareness about the fact that it's there and the services that it provides. And the tactics that we're using and that we'll talk to you briefly about today include outreach. This is our on-the-ground outreach targeting businesses, faith-based organizations, and apartments. We are deploying street teams to hand deliver flyers to households in 2 different zip codes. We'll talk about events and how we're using those events to book appointments to increase utilization at the health center, a direct mail initiative, and then paid media. I'm going to let Edwin Evans, our outreach and enrollment coordinator, talk about our business outreach efforts. Isela Guetta is also on the call, our outreach supervisor, and I believe I see one of the consultants that's been assisting us with this outreach effort, in a multiple zip codes, not just the Hornsby Bend area. Edwin?
Yeah, sure thing. Great to be with you all today. So we still have our community health workers doing the small business outreach. And so they have visited over 40 businesses in the Hornsby Bend area. And they initially did that for the COVID-19 outreach. But we also had them circle back to those businesses and revisit them to promote the reopening of the clinic. So they've done that. These businesses include the churches, the apartment complex, the supermarket. So all of those small businesses in that area, off the 969 and in that area, they've done that. Yes, so that's.
And you want to talk about the resource kits they're delivering and how they've added the flyers for the clinic promotion?
Yeah, so in the resource kits, we have hand sanitizers and masks that were given out, the COVID-19 flyers with the testing locations and the testing sites. We also have the self-isolation information in there. And we also provided the businesses with these posters that have the 3 W's, wash your hands, watch your distance, and wear your mask. So we're also promoting that. And we also are providing them with behavioral health business cards that we received from Integral Care. It has some great information on there and phone numbers for anyone that would need some behavioral health support.
And then this last week, they went out and then began specifically promoting the Hornsby Bend Health Center. Correct?
Correct. That is correct. So here's the flyer that we're promoting with the reopening of the health center. So we have our street team that is going out this week, actually. They're actually going to do the Beckett Apartments today, and then they'll be canvassing the houses Thursday and Friday. And so that would be for, let's see here, all the Kennedy Ridge, Forest Bluff, Austin's Colony, and the Beckett complex as well. So for our community health workers, they're going to the Beckett Apartments. That's a huge apartment complex there. The community health workers go inside the main business and they kind of promote through there, and they make sure that the flyers are with the check-in office and everything, that they have posters and flyers and things there. Now, our street team canvassing, they're going to go door to door and put our flyers on each individual apartment door so that they can have that. And so the street team is canvassing they're doing 3,500 flyers in 7, 8, 7, 2, 4, and 2, 5.
Leonore, do you want to talk about the recent events that have also been used to book appointments at the health center?
Yes, thank you, Ted, and good afternoon, everybody. And yes, so to speak more on the events, on September 26th, we hosted a Hornsby Bend PPE event. This was held at the Hornsby Dunlap Elementary, which is located off the 969, which is one of the main roads there in the area. And we did this event as a drive-through model, just to keep everyone safe. This was a whole collaborative effort with the enterprise. So we had staff from Sendero, Central Health, and Community Care present so that we were able to address all the community needs. And basically at the event, we were able to distribute 968 PPE packets, which included all the information that Edwin mentioned earlier. And also, since we had staff there present, what we did is that we allocated some parking spaces where if anybody was interested in needing help with setting up a medical appointment, they weren't aware of the clinic, they were able to pull up on the side and we were able to help them, assist them with those appointments. So we ended up scheduling 42 medical appointments. This included a wide range of services from follow-ups, well child exams, chronic conditions, flu shots. We also were able to transfer some patients that were currently at another clinic, but that actively live in 78725 to the Hornsby Bend Clinic. And then also from Central Health being there, we were also able to schedule 15 MAP eligibility appointments. So it was a huge success. We are very proud of it, and we were able to serve the community. And then another event that we did also on a Saturday was on October the 10th. This was more like a flu shot clinic. So Community Care that day did at a lot of our clinics throughout, did a flu shot clinic where we were providing flu shots for our established patients. And we did the same at Hornsby Bend, but we also added a little bit more services to give an opportunity to introduce our new provider, which is Melanie, who's pictured in this picture. So we did more like a meet and greet provider. For anybody that had never seen the clinic and was interested in possibly transferring services, we were there present to provide tours and snacks. And then, of course, we had scheduled the flu vaccine. So out of the 33 that were scheduled, we were able to see 22. 22 were received a flu shot. And then from them being there and talking to them as well, and just showing, giving them an opportunity to meet the doctor and checking out the facility, 6 of them transferred their care as well to Hornsby Bend. And then there was a couple of our patients that were coming close to needing to renew their either MAP card or community care card. So we were able to help 8 people on setting up appointments to get that renewed. And as you can see the quote there from one of our patients, they said that they are so happy to have a clinic in Hornsby Bend. And then finally, here's an example of the postcard that we have been sending. So the messaging is basically to let the community know that there's a healthcare there near you. So we're trying to bring awareness to the community that this is something there, that we can provide medical services. It lists, of course, the location, hours, and time. And we did a total mail out of 6,500 flyers this week. And we're prioritizing in the zip code 78724, which is the Colony Park and Hornsby Bend area, and then the 78725, which is Austin Colony. And due to a lot of our marketing efforts, so our utilization rate back in March was at 58%. And now with all this increased media and all the marketing efforts that we've been doing, we're happy to say that currently we're at 81%. And also this week, we're super excited to announce that we are now offering COVID testing in addition to our medical services at the clinic. And our first day was this past Monday, October 12th, and we saw 12 patients that day, which is really good for a first day opening.
Thank you, Leonard.
Okay, could you wrap it up so quick, because we have some other items.
I'll wrap it up really quickly. We're also doing paid media, and this is the schedule. The paid media started last week. It includes streaming audio on Spotify, free Spotify display, so online display advertising, paid social media, and print advertising. Our target audience is up to 200% of the federal poverty level, and all the media is geo-thin. So it's really it's people who live within 2 to 3 miles of the clinic, the health center, will see the media. And this is just a quick summary. It's in your packet, but this is what we anticipate. 78,000 impressions from the streaming audio, again, free Spotify, geo-fenced for that area. We expect almost 880,000 impressions from the online advertising, 375 impressions from the paid social media. We have full page ads running in the Villager and El Mundo. And we also have purchased a new billboard, which I'll show you in a second. And this is just the media spend broken down by tactic. So we are investing just for this approximately 6-week period about $37,000 with an anticipated 1.9 million impressions, which is a lot of impressions for a small area. And we won't have the added value or return on investment until the media finishes its run. And I finally wanted to just show you quickly a billboard that should be going up today, I hope. But this billboard actually is going to promote the Hornsby Bend Health Center and Del Valley with a really simple message: health clinics near you. It is the address is 3231 Highway 71 East. So it's an east-facing board, which means as you're driving towards Austin on Highway 71, you'll see this really large billboard, and it's about at the turnoff of 973. So people coming in on 71 would see it if they're coming from Hornsby Bend, and also if Del Valley were closer, then it would promote that location as well. I won't spend a lot of time on this. These are just examples of some of the social media advertisements. So quality healthcare is closer than ever. Our Hornsby Bend Health Center is open to serve you. Display banners, quality healthcare is closer than ever. All of our ads are in English and Spanish. An example of the print advertisement: quality healthcare is closer than ever, and the Spanish version. And I'll pause and let you ask questions if you have any. Thank you for your time.
Okay, I just want to give a heads up to Dr. Bell. We'll probably be running about 10 minutes over since we didn't start for 10 minutes. Hopefully that will be okay with you all in terms of our meeting time, because we have some questions and we have about 3 other items to go through. Most of them are rather quickly. So with that said, are there any, I have some questions, but I'd like my colleagues, members of the board to ask their questions first if you make them rather quickly. Any board members have questions? Manager Masaitis.
Well, thank you. Mine is really quick. I really appreciate it. I'm thinking maybe perhaps in the future, as board members, as governing body of this organization, that we need to be out within the community and listen to their needs as well, have hearing issues directly from them. So I ask that we propose this and hear it directly and be there as an issue. So that is really my one feedback, and I have to log off, and bye everyone.
Okay, thanks very much. I'd like to piggyback off of that, and I'll discuss it a little later, but I appreciate your comment. I agree with you. Other board members?
I have a question, final question.
Okay.
With respect to the sheets that have been provided to us, I'd like to know what it is that Austin Public Health has done with respect to all the planning that is being proposed, or that we just got an update about, so that we're not overlapping what they have done and what we are doing. That's an effective and efficient way of calculating where our programming needs to be. If somebody can provide that, not today, but at some point in time before we continue. Thank you.
Thank you. I think that's a good question. I really appreciate that, Manager Valdez. Concur. Other board members? Not seeing any. I have a couple of questions. One is, I want to compliment you on the job you've done, particularly in terms of the outreach. I think you've done enhanced information out there and a lot of data. My question goes first to what has been the results in terms of increase in productivity at the center we had. I think Ms. Dominguez indicated that we started off in March at 55%. We're now at 81% utilization, if I heard that correctly. My point is, first, is that a correct statement, Ms. Dominguez? Is that correct understanding what you're saying?
That is correct.
Now, is that 5 days a week, 3 days a week, 2 days a week? What is the frequency are we out there?
So we are currently there 3 days a week, which is Monday, Wednesday, and Friday from 8 to 5.
Okay. And therein, and I appreciate your information, therein lies a concern I raised. And I've raised it several times, and I'm just raising it again. I've worked with and I've talked with people in that community about the fact that we don't have a presence there. We're there 3 days a week. We've increased from 55 to 81, but we're still only 3 days a week. When we look at the data in terms of mortality and morbidity, this zip code particularly has high rates. So my question is, how can we enhance what we're doing beyond what we're doing? I think the job we're doing is good. You're doing a fantastic job. You're doing a lot out there, but obviously it's not getting the utilization we need. So I talked with a couple of people about the possibility of enhancing activity. So can you quickly tell us what, beyond what we're doing currently with our staff, are we doing in this community, Mr. Giesland or someone, in terms of outreach?
Well, I think, Chair Jones, what you just saw is the extent, both in scope and depth, of the outreach activities that we've done, and then what is also currently planned, because you'll have some sustained media as well. Now, obviously, as we progress on the long-term health and wellness center, we're going to be circling back with the community and engaging the community throughout that process, both at the program and service planning levels, as well as the construction aspect of it. Now, to come back to the temporary site that's there now, I'm going to oversimplify it just by saying the board would need to take action to reimburse community care to go from 3 to more days per week. I mean, to me, that's the essence of it here. I think community care is trying to operate within reasonable bounds and under a model of sustainability based on payer mix. And I'm oversimplifying it, but I think at the end of the day, if what you're looking for is more days per week, then there's a discussion that needs to be elevated through the full board, through the process, to determine, does the board want to reimburse community care for that?
Well, I don't think, certainly I know we don't have time today to discuss that. I do suggest at our future meeting, we put that as an agenda item for discussion. We're not going to resolve this issue out in Hornsby Bend, Del Valley, Colony Park, unless we utilize and maximize our utilization. We know this is where the issues are. And for us to have this area, particularly 78725, with only 3 days a week, given the data that we have on mortality and morbidity of our population, we're part of the problem. It sounds like a chicken and the eggs. They don't have enough more days because they don't have enough clients. They don't have enough clients because our clients don't know that they're there, or we're not there enough. So we're going to have to begin to address this issue. So I ask that we put that on the future agenda item. I have some suggestions I would like us to consider, and I'll put this on also on our next agenda item too, is if we look at whoever we're currently consulting with. I think we have 2 or 3 providers out there beyond what we're doing to see how we can do some specific things. Particularly talked about, can we host Zoom in-person planning meetings with citizens in that area? Can we work with the leadership of the homeowners association? Okay, somebody, would you please? Someone needs to turn their microphone off. Okay. Work directly with the school administrations and the homeowners association to be able to augment utilization at these areas. And these are things that we probably don't have the resources to do, but perhaps we could contract people to do with those we currently have doing these things. Provide some connectivity with other service providers in Del Valley in terms of coordination of our services. Consult on stage program and implementation scheduling, holding health classes and things beyond just what we do, diabetes, cancer, education prevention program. These are things, this is a public health model, but in order to be able to enhance utilization, we need to be able to do these kinds of things. Hold a focus groups on why people aren't going to the clinic. I know we said we did something with some of our centers, but have we done it with the people in the areas who are not utilizing our facility, not those who are going to other facilities? Provide Central Health with updates on places where we can get feedback, such as places, some of the venues in those areas. Can we consider augmenting our contract with our current service providers? I think we have 2 or 3 of them out there to be able to do these kinds of things. So these things we could perhaps consider doing. I'm not asking for a proposal to do it now. I'm just asking, is that conceivable? And do you think that will enhance our ability, Mr. Giesland?
Mike?
Yes, Ted.
Can I weigh in real quickly? Just a couple of things that Mr. Manager Jones mentioned we are doing. So we are working with HOAs. We are very active in all of the different Facebook groups out in the area and working with the leaders of the most prominent HOAs in those neighborhoods. And I see Yvonne and Jana are on the call. They can also weigh in. We are also working with school administrators. In fact, Del Valley ISD has been very helpful in helping us get the word out to students and parents. And then finally, you mentioned the idea of focus groups. We've talked about the possibility of doing either focus groups or phone surveys. Just due to the pandemic, bringing people together might be a bit of a challenge. But we have, in fact, been exploring that possibility. I don't have anything to report back to you yet on, but to survey people who live in the area, map patients, also people who may not be connected to health coverage, but would still be in our target population. So those are things we've worked at and can report back to you on.
Well, I see on our call, and I don't know if anyone from the Latino Healthcare Forum, which I think is part of our contract outreach, but I do see Dr. Moody, who's part of the outreach effort. I guess my question, I know this is for staff only, but I had hoped that we had the opportunity to get feedback from the community with regards to their perspective on what we're doing. Certainly, if we don't have time today because we are running late, I would like to have time at the next one to hear from our consultants on what they are doing and what they think we can do to augment and enhance what we're currently doing. I think what Manager Masaitis said earlier goes to this point, is that we need to do more to enhance those other entities in these communities. And I think our outreach efforts are doing great, but I think we need more of them in this area. So I would ask that at our next meeting that we invite our contractors to come and talk and give us some strategies on things they think we would do as well. Okay, Mr. Deep, I'm sorry, you can go ahead.
Mike, if I can just say something really quickly to address Mr. Jones' point. I recently this week just started on a project to kind of address what you're saying, Mr. Jones, where all the patients that we have in the 78724 and 25. So basically it's the community that live in the area. I am doing phone calls to them to ask them what if they've heard about the clinic and if they would consider transferring services to the Hornsby Clinic. So this is a project that I just started working on this week, where we are engaging the community and wanting to get their feedback.
Are these people who are currently going to our other clinics?
That is correct. So they live in the area, they live in the community, but they're going to another clinic. So we are engaging with those individuals to see if they're aware that there is a clinic there, and if not, what would be the reason why they wouldn't want to change, or if they would consider changing. Yes, sir.
And thank you very much. I appreciate that. I think that's very valuable, and I think we need to continue that. But my focus also is on those folks who are in those areas who are not going to those clinics and who do not know about the clinic, who's around the corner, and who may not be aware or who still believe the clinic is closed. So those are the areas I'm talking about enhancing. So I encourage you to continue what you're doing, but I think we need to look at those others as well. We're running really short on time, so Mr. Giesler, could you respond to that question? Because we only have about 10 minutes left.
Yes, sir. And I think that in conjunction with our partners, yes, we need to have that conversation, but I feel like there's a misalignment here, because you have staff teams as well as contracted partners like C2H, Latino Healthcare Forum, and others that are out there in the communities doing a lot of this work. And then there's the service element of it. And as you saw, there's a lot of programming that's going on right now, both at the community care level, but also at our level, and working with these different partners. I feel like there's a disconnect here. And really, I think what I'd like to do is elevate this and up so that we can get a majority of the board to look at what we're doing now, hear from community partners, clinical partners, and people from the community, and then figure out where the gaps are. Because otherwise, and I understand everything that you're saying, but then are we coming back and duplicating efforts, or are we going to come back and say, yes, we're already doing this, but it's still not to the satisfaction of the board members. So I'm not quite clear about how to go about getting the full board to opine on this, and so that way we have a clear direction from a majority of the board saying, yes, this is how we want you to redirect your efforts based on what we've seen today.
Well, I agree with you. I wouldn't be ready to carry it to the full board until we have a profile of what we're currently doing and the synergy of those efforts. I agree that we're doing a lot out there, but obviously it's not having the result that we want based upon the utilization we have and the operations we have. So I think that before we go to the board, we need to come back with a plan to enhance a 5-day operation at that facility by enhancing outreach and utilization from what we currently have, and growing what we can do out in that area. And so before we go to the board, I'd like for us to do that. Hopefully at our next meeting, I would ask if we put on the agenda a review and discussion of those contractors in concert with our outreach staff to talk about how do we synergize those effort and enhance them where necessary.
I just have—
Yes, and it's okay. We could pull in our clinical partner into that conversation as well, because they're the ones that ultimately have the doctor-patient or provider-patient relationship. And so that way, I think you get the benefit of all the voices. But I think that core question that you just asked right there in that last statement, I think clears it up, and I have a better sense about how to bring this back to the subcommittee. Thank you.
Okay, I appreciate it very much. Let's move on, because we have a couple of other. Item number 5 is and I think it's a brief one, review and update on planned land acquisition for the city track for the future Loyola Town Center. Mr. Lamp, are you there?
I am here, sir. Thank you.
Sorry
I'll be
for
very
the
brief.
delay.
We have identified, with working with the City of Austin, we've identified a specific tract of land. A survey and appraisal have been completed, and we are holding weekly meetings with the City Economic Development Department in particular, but also supported by their real estate team in office, to hopefully close an agreement by the end of August. I doubt a formal agreement will be ready for execution at that point in time, but at least the term sheet and the basic conditions of a acquisition by Central Health should be complete.
Okay, thanks very much. Any quick questions for Mr. Lamp? Not seeing any board members in the, okay, item number 6, discuss an update on the COVID-19 response, including testing and distribution of personal protective equipment. Yvonne Camarera and Elizabeth Marrero will be presenting. And go ahead, you can do it a little shorter than 15 minutes. If you could reduce it, I appreciate it.
Yvonne,
You might be on mute. Can you hear me?
yes,
Carla?
yes,
Okay,
we can
great.
hear you.
Thank you.
And I put
Thank you.
your slides in.
I appreciate this. I think we'll be able to make up a little bit of time here, Chair Jones, so I'll do my best. Just to the next slide really quickly, I just want to go over our continued, and again, these slides are always moments in time, so obviously our numbers have changed since the packet went out last week. We're currently at, for this week, at a 11.5% positivity rate. We are starting to see a slight increase in our positivity rate overall. And this also goes, we're beginning to see also an increase in the number of tests that we're performing. Over the last few weeks, we're starting to see an uptick in our testing that's occurring at all our testing locations. So we're continuing to monitor to see if that is in accordance with what's happening in our community. And then overall, we're still seeing this week our positivity rate for our Latino community is almost 15.5%. And these are with the updated numbers that are a little different from what you have in front of you. And then our positivity rate is also starting to climb for our African American community. It's up to 8.1, and this has been the highest that we've seen for a while. So again, we're starting to trend on that out as well. I know that Leonora covered the changes to our testing locations, so I'll be extraordinarily brief there as well. We are happy to have testing going on 3 days a week at the Hornsby Bend location. We think that this we moved from 1 day a week to 3, so we think this will be very helpful. We do have arrival times, phone number that we're asking, and really this is about the size of the parking lot and ensuring that we have a great pacing, so the community isn't waiting very long. And the other major change is that our Burleson location will be adding Saturdays starting this week, so we will be there. We're adding an additional day, so we have both a south and north location where the community can receive a COVID test 6 days a week. So we're moving forward with that as well. So I will stop there for time, and then I know Elizabeth will be continuing to discuss our efforts around our distribution of PPE, and I'm available to answer any questions.
Okay, Elizabeth.
Hi, good afternoon. So I'm going to go through mine really quickly. Everybody's familiar with the PPE campaign that we have with Austin Public Health and the Travis County Health and Human Services. We are on track. Enterprise staff has assembled almost 12,000 kits that we have provided for our patients. And we have distributed almost 6,000 PPE kits to the community care clinic sites. They are listed there on the slide, which pretty much have covered all of them. We have distributed over 92,000 masks, 22,000 hand sanitizers. We're doing very well with the distribution. We're going to continue. We've continued to support community-based organizations when possible with either educational pieces that they can provide or hand sanitizer. And I've also listed those events and organizations that we've supported. We have about 4 events right now in October that we plan to distribute PPE at, and they're mainly flu events. At this point in October, we've completed 4 in September,
and at the drive-through events in September, we distributed over 3,000 kits, and 8,500 community care patients were invited to those events. The events in September were in 78725, 78744, 78758, and 78724. They were very well received, and all our events did very well. So we do plan on having and supporting events in October, and so that we can continue the campaign. And although our goal has already been met, we'll continue to support it as long as we have the PPE available to distribute.
Okay. Is that it? Is there another slide? Okay. Thank you very much for the work you've done, and really appreciate that. That was very informative, and sorry I had to rush through that. However, are there any questions before we adjourn our meeting from our board member, Manager Valadez?
Very quickly. So when I see that so many packets or so much PPE has been distributed, it'll say distribution or 8,000 people invited. Can we have a real count? Is it a smaller amount of people that are actually receiving the PPE? That's my interest.
No, those are accurate.
And also, if they're getting more than one, let's say it's a big family, it's hard to just give them one packet. It would seem that it would be more appropriate to give a packet per person, but I don't know how y'all are doing it there. I've seen what they do at other events, but if you could just clarify.
Those numbers are accurate. That's why you'll see more masks given out than kits. And then I've been tracking the numbers that we're doing, and then so we do larger families, or if they say they're picking up for their neighbors, we've been very flexible and as generous as we can be with giving it out.
I appreciate it.
Okay. Thanks
so
very
the
much.
8,000 or the invited means that there are actually 8,000 people attending that have attended.
No, that's what the 8,500 community care patients were invited to events. And then it depends on the event, but about, on average, we're giving out 1,000 kits and about 500 cars have come by.
Okay, that's an important number for me, okay?
Okay.
Thank you.
Thank you, Manager Valdez. Unfortunately, we're going to have to end our meeting because we've run way over our time, and I appreciate Dr. Bell allowing us to go the extra 10 minutes. Item number 7, we are to confirm our Eastern Crescent Subcommittee meeting date and time. Manager, our next Eastern Crescent Subcommittee meeting is tentatively scheduled for Wednesday, November the 1st at 12 noon at the Central Health Administrative Offices, 1111 East Cesar Chavez, Austin, Texas, 78702, and or remotely by video conferences, depending on the status of the governor's declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment.
Move to adjourn.
I have a motion for adjourn.
I second.
Second. All in favor say aye.
Aye.
Our meeting is considered adjourned. Thank you so very much, managers and community.
Thank you.
Dr. Bell, it's yours.
Thank you, Chairman Jones. I think that was an excellent subcommittee meeting. Lots of good discussion and lots of things that we need to follow up on in the future, maybe to have a little bit deeper dive into some of those topics. Before I call the meeting to order, there was one member of the public that had technical difficulty signing in to speak. So I will turn the floor over to Jana Allen to read the rules and recognize this member of the public to speak if she or he is still present.
Thank you, Dr. Bell. With that, before we move forward, I'd like to make sure that the member of the public who signed up to speak, Dr. Moody, are you still here with us? I saw your video go away. Okay.
Let me see if I can.
Sorry, go ahead, Perla.
Okay. Wanted to make sure they weren't having difficulties with the mute button.
If he's not, then I can speak on our behalf if he's dropped off or.
Okay. Chair Bell, what would be, or Perla, what would be your guidance as far as waiting if he returns, or?
Thank you, Jana. I think if Ms. Greer states that she can speak for him or speak for the group that he is representing, we would like to hear from them, and then we will continue on with our meeting.
Okay. So what we were planning to do was give kudos to Central Health regarding the turning over of the land for the clinic. We have been in the community. The community still reaches out to us. We are not directly working in the community with the contract, but Latino Healthcare and Community Coalition for Health, we are really partnering with the outreach program. Actually, the last meeting, we decided that areas that they're having issues in, we will step into, and areas that we may be having issues in, we will step into. But now that I have heard, and that we have heard, that there's not going to be any turning over of the land by the end of this year, my question would be, how do we address this to the community? Because right now, since we're out there, one of the things that they are excited about is the fact that they're looking to see land, the property's land being moved so that they can start seeing a structure go up. And so now we will be back in the community knowing this information, because the information was, hey guys, this is going to happen. You see, it's going to happen. And now I have to go back out in the community and say, ugh, y'all not going to see it. It's not happening. So I need some help on how we would address that.
That is an excellent point, Mrs. Greer, and thank you for bringing that up to us. We will have some staff follow up with you with regard to that, and hopefully give you some helpful information to address that issue. It's definitely a sort of conundrum, a communication conundrum that we need to make sure that the public is sort of on the same page as we are. With regard to this. So thank you. I appreciate that.
Thank you for giving us the time.
Sure. Okay. It is October the 14th, 2020, and it is 1:16 p.m. As a quorum of the committee is in attendance via our video conference, I'd like to call to order the meeting of the Central Health Strategic Planning Committee. Members, the agenda will be taken up out of order today. Item number 4 will be moved before item 2. So the final order of the agenda will be 1, 4, 2, 3, 5, and then 6, and adjournment. Okay, agenda item number 1, review and approve the minutes of the August 12, 2020 meeting of the Strategic Planning Committee. Do I have a motion? Manager Valadez.
I move the adoption of the minutes.
Do I have
is it the August 12th, 2020 Strategic Planning Committee meeting?
Yes, ma'am. Do you have a second? Manager Jones. All in favor? Any opposed? Motion carries. Okay. Agenda item number 4, receive and discuss an update on the development of the Central Health Board reporting dashboards associated with service level reporting for fiscal year 2021. Members, before I turn it over to staff to present this item, I want to outline for you that we're going to bring this item back a couple of times. What we want to do right now is to sort of get us oriented to the dashboard and what it contains and the information it contains. I know that you'll have questions with regard to the data that is included in the dashboard, and you may have some other questions along with that. We will take it just so that we can keep our time efficiently and use our time efficiently. We will take up this item again, like I said, in future meetings. So I have Monica Crowley, JP Eichmiller, Ashley Levelette, Sarita Clark-Leach and John Morgan presenting on this item. Monica, you want to take it off?
Yes, thank you, Dr. Bell. Monica Crowley, Central Health. Before I turn it over to Sarita, JP, and Ashley, I just wanted to let you guys know that this approach to the dashboards, the team started working on it, I think about 6 weeks ago. So this is still, the data inside it's still in process. Sarita will explain a little bit more about that. But today we wanted to show you, get feedback from you on the look and feel of these dashboards to determine if they're directionally appropriate. The work that the team has put into these, I really think takes our approach to dashboards to a different level. And with that, I'm going to hand it off to Sarita.
Hello, everyone. Ashley Lavilla will be presenting the actual dashboard today, but as everyone has stated, this is more or less a mock-up that we'll be presenting today. We're finalizing how we've categorized certain visits, and so still doing research and looking to annotate where we can annotate, and so that you guys have all the information once the dashboard are published up that speak to some of the questions you may have. But with that, I'll let Ashley take it away.
Thank you, Sarita. Okay, can everyone see my screen?
All I see is dark.
It's just dark, Ashley.
The black screen.
There we go.
Okay. Okay. So if everyone can see my screen now, I apologize for that delay in connection. So as Sarita mentioned, today I will be going through a mock-up of a new dashboard that we have created to look at enrollment and demographics for our population. And so as you'll see here, it's broken out into 4 main areas. So I'll start reviewing in the upper left-hand portion here, these indicators that we have included on enrollment, visits, and Travis County general indicators. And so first off, for enrollment, we have 2 different looks here. We have the number of members who were actively enrolled in the prior month. And then we also have the fiscal year to date enrollment total. So for these indicators, we have both the total number of MAP basic, and sliding fee scale enrollees, as well as it broken out by each program. So you can see the totals for MAP basic, and sliding fee scale here. In a similar format for central health visits, we have information again presented for monthly totals and our fiscal year to date totals. And this is broken out by our service lines. So currently we have total visits as well as behavioral health, dental, primary care, specialty, urgent and convenient care, as well as other types of visits. In this final column here, we have just some general information on the Travis County population. So we have the estimated population as of 2020. Additionally, we have the count of households and the number of percent of households in poverty that's below 200% FPL. Additionally, you can look at the number of families within the county and the families in poverty, and this is for below 100% FPL. And so moving down here, we have two charts, and one of these are looking at enrollment and the other is visit totals. So first, we have a 2-year look back at the number of active enrollees by month. And this is, again, including MAP Basic, and sliding fee scale enrollees. And so you'll see here, if you hover over any of these bars or points, you will get information on the total for that month. You also have the ability over here, the functionality to turn on or off any of these features. So you could look at just a subset of enrollment if you would like to. Additionally, we've included a slider at the top here that allows you to refine the time period that you're looking at. So for example, if you wanted to only look at enrollment within the past year, you could do so by moving that slider. And so similarly, we have this broken out for monthly visit totals. And this is the same service lines that you saw above. As Sarita mentioned, this is a mock-up and we're still looking at this data right now. But you can see here some of the trends that are present. And again, you have the same functionality as with the other chart. We've also noted here that for visits, you'll notice that recent months are likely to represent undercounts because of our lags in the billing cycles. Next, moving over to the bottom right-hand corner, we have a series of demographic pie charts. So this first section here looks at age breakdowns, and this is for the Central Health enrolled population in fiscal year 2019, as well as the visits that occurred in 2019, and then the overall Travis County population as of 2020. So if you were to hover over any of these areas, you would see what those breakouts look like. Similarly, we have this broken out by gender as well, and race and ethnicity. So notice here for the Central Health population, our race and ethnicity data is combined, so we have single pie charts here. And our Travis County data set breaks out race and ethnicity. So here we have a pie chart looking at our ethnicity for 2020, or our race for 2020, as well as our ethnicity. And finally, above the next main section that we have is the series of maps, as well as notes for the dashboard that help provide some background, as well as some specific notes for the data that is used within this dashboard. So this first map here is looking at our enrolled population by census tract for fiscal year 2019. And so there's a few different functionalities that each of these maps has. So you're able to click on any census tract and look at some more specific information related to it. Additionally, you have the option to zoom in or out to a specific area of the county. We also have the functionality here where you could do a specific place search. So if you were interested in locating a specific area, you could do that as well. So we also have the number of patient visits for fiscal year 2019 by census tract. And then the number of families in poverty in 2020 by census tract as well. And finally, we have two maps that we have included here that we have as a combined look at the number of visits and the poverty within the county. So trying to look at where those different concentrations align. And so this first one here, this bivariate map that we're looking at, you'll notice this key over here shows us where there's varying levels of poverty as well as number of visits within the county. And so actually, all of these elements here, you're able to expand them. So for this, I'll go ahead and expand this map file. And so you'll notice here for the county, that the areas of blue here are those areas that have both high poverty and a high number of visits. The areas of green had lower poverty but a high number of visits. These areas that are gray were low poverty, low number of visits. And then as you go into the pink colors, that's where you have high poverty and a low number of visits. So this is one way that we've provided that you can look at that data simultaneously. Additionally, we have this other version which is using the same data but is just a different way to look at it. So in this version, you'll see that the darker the color is for these circles, the higher the number of families in poverty. And then the larger the circle is, the greater the number of visits occurred within that census tract. So again, this is just two ways to visualize the data. And with this, obviously you have some of these crossover when you're at that wider view, but you are able to zoom in to a specific area and see that information and get more information on the census tract. And finally, here I'll just quickly go over. So this is our current notes section. So we have here definitions for various keywords that we use throughout the dashboard. We also have more information on poverty guidelines and what the current poverty guidelines are. Information on our sources, as well as a few specific notes on how the data has been prepared for this dashboard. So at this time, if anyone has any questions.
Manager Bell, I received a question regarding the release of this. I just wanted to note, I think our current intention is to, as Sarita mentioned, this is an initial mock-up. Our intention is to coordinate with the rollout of the new website and have this published and ready by the end of the month once we've been able to work out some of the kinks with the data.
That's great. And so to be clear, JP, this will be available not only to board members, but the public in general via our website?
Yes, sir. And we hope this will help increase the transparency among the public with who we're serving and how we're serving them.
That's great. That is fantastic. Ashley, JP, Sarita, excellent job. I'd like to open the floor up for any questions from our members with regard to this or comments. Ms. Valadez?
Okay, I think you just kept it on the screen. That's okay. You don't need to see my face while I'm speaking. Now I had some problem hearing. When did you say this is available, or is it available already for us as board members?
We're targeting the end of this month.
Okay, not until the end of this month. So as of right now, what you presented to us, where can we get those numbers? Are you going to provide them to us right now, or do we have to wait for 2 weeks before we see something? Since apparently the numbers are already available.
So, Manager Valadez, those numbers are actually available currently on the website, on the current website. It's just not in this format. So you'll see those high level numbers. But the other thing that I wanted to make sure that you understand was that when we went through and we were recategorizing these visits for relative to what you're seeing here, there were some questions that we had around that we knew that folks would be asking as well. So we wanted to make sure that we have a clear understanding of what those issues are so that we can annotate appropriately on the documentation page that Ashley demonstrated.
The reason that I asked that, Sarita, and thank you very much for providing that information, is because what I noticed when I was just looking at something, maybe it was 2 weeks ago or last week, not recently, when we got the breakdown on the number of people who were eligible to be enrolled in MAP, but that were not actually enrolled in MAP. Do you remember that screen? That I think it was you that made the presentation per zip code, I think, or census tract. And I noticed, if I'm not mistaken, that there was a large number of possible enrollees eligible in Central East Austin, which is a 78702 zip code, my zip code. And it had a very low number of actually enrolled. But it's not been included as a targeted site for like the Eastern Crescent community has. So I wanted to know, did East Austin or Central East Austin drop off, or are they still in a targeted, or being targeted? Because it didn't appear that that's what we were referring to. And so I asked for you to please clarify it to me. Because what I want to see is, especially as we're trying to analyze where the disconnect is, since we're such a highly gentrified and displaced community, I wanted to know, when are we going to also start targeting these others? I know Eastern Crescent, but in addition, those are within from 35 East that are eligible for MAP but are not enrolled.
And before I respond, it looked like Manager Greenberg may have had something to add to the question, or?
I agree. Manager Greenberg?
Well, I just wanted to see, this might be something that we asked Mr. Giesland to respond to, because I know that we have had discussions looking at the new demographic material and our strategic priorities in our budget. Mr. Giesland, did you want to address some of this?
Yes, Manager Valdez, I need you to, can you restate what you just said as a more concise question?
I'll try and make it very quick. I remember seeing, maybe it was in the last month's set of meetings, somewhere in there, that we actually got from, I thought it was community care, the number of people that are enrolled or eligible for MAP, but that are not enrolled in MAP. And
that presentation was part of our demographic report.
It was.
And so fast forwarding it to for adopting our budget priorities, I want to make sure that we didn't lose sight of the fact that we have a lot of people that are not enrolled in MAP yet are eligible. And I think that my Central East Austin community was the largest number of eligible but not enrolled. And so I wanted to make sure that we were targeting them also.
So if I may clarify that.
Gentrified, you know.
If I can
understand, Mike.
If I can clarify that, I think, yes, these were numbers that I recall too, Manager Valadez, good point from, I think it was a presentation that JP gave, a prior one, on the demographics. And Mike, I think the question is, what are we doing as far as targeting those areas that we saw from that demographic drill down that he did, that may be, I think, in, like Dutch Springs and Montopolis, where they were not accessing the MAP services as much.
Right, and that's really needs to be its own separate agenda item. When you talk about MAP and MAP enrollments, managers, there's so much that's going on, especially now that we're standing up or have just launched operations around a call center, but are also working through MAP re-enrollments right now. And then obviously the engagement of the outreach team has a lot of information and tactics that they push out into the communities to encourage people to call and seek a eligibility appointment and to see if they can qualify and then enroll in MAP. And so there's a lot going on there, but I think to try to sum it up in one sentence is almost virtually impossible without having all the right people at the table and pull together a proper briefing on that.
Manager Greenberg?
So could we make a request now Chairman Bell to have this on a future meeting, because I think I completely understand what you're saying, Mike, and but I understand and would like the information also that Manager Valadez is speaking of, and I'm sure other members would. So if we could have this on another meeting as its own agenda item.
That makes sense, and I agree, Manager Valadez.
Just one quick follow-up because of my my experience in my community and as a volunteer for the Austin Tenants Council, and looking at the displacement and gentrification that's going on in our neighborhood, and pushing for map expansion. There are entities like the Austin Tenants Council that sees gets a lot of questions, and they did work and do currently still do, if I'm not mistaken, or did up until COVID. We're doing joint meetings with volunteer legal services for evictions, et cetera, but they also had a huge number of resources that were made available to the people coming in. And so that's something I'd like for us to try and get Central Health to look at partnering with or expanding into our list of entities that we're going to be considering for co-locating and services. Thank you.
Thank you.
Understood.
Go ahead, Mr. Giesland. I'm sorry.
Chairman Bell, and I'm not trying to conflate or confuse issues, but if I think about the conversation that we had in the Eastern Travis County Subcommittee around what Manager Jones seeks to discuss at the next agenda item, plus, or the next meeting, plus this agenda item here that's we're formulating. It's a lot of the same staff working. It's not 100% overlap, but it's a lot of the same people that will be working both issues. And so perhaps if you and Manager Jones could visit offline and provide some more guidance about how to proceed on this. Because at the same time, we're also launching the new fiscal year, and all the work that you all have outlined in your budget resolution as being priorities, we're staging and being so that we're in a position that we can deliver on that as well. So at some point, just to put it simply, we start spreading ourselves too thin, and then we can try to do everything, we wind up doing nothing at all.
That's a great point, Mr. Giesland, and I think that Manager Jones and I will work together to try to make sure that we can efficiently cover these items.
Thank you, and they're both very important conversations, and we need to have them. Absolutely.
Would you like for me to send you all notes on why I'm considering this and suggesting it? I'll do that. I'd like to be included in the meeting if at all possible.
If you would send it to me, I would appreciate it.
Thank you.
Very
this
much.
was a concern I had when we adopted our budget.
Thank you, Manager Valadez. Manager Jones has been waiting. Can we, I'll come back to you, Manager Greenberg.
I just have a quick question. It's not related to this item. I mean, not related to this discussion, but as I've asked for several times with JP and also Sarita, is it possible that this data could be overlaid with public health data in terms of mortality and morbidity, so that we can look at our utilization in comparison with what's going on overall in these parts of the county, these maps?
So Manager Jones, we do plan to have, our next iteration will have prevalence rates for chronic diseases. Mortality data specific to our population is a little harder to come by. APH has mortality data for the entire all of Travis County, and when we focus in and hone in on just our population and what rates look like relative to just our population, that map that you may be used to seeing looks a little different. So we do want to have data that is specific to our population, but if and we can have a further discussion about, if you do think that it's useful to have that overlay of the general population's mortality, morbidity.
Well, the purpose of asking to that is to see to what degree our population contributes to that. And the only way we'll do that is to look at it. We can look at ours, which I agree is vital and is our main focus, but are we the greater portion of what's going on in these parts of the county? And so should our intervention, or should APH intervention or other intervention be addressed based upon what the data is telling us?
If we want a general overlay, an overlay with the general population, we could certainly look into that. But we have been requesting that population specific to our to our enrollees for quite some time now, and we've been, you know, told that that our request is deprioritized because of COVID now, but it's been ongoing for.
But we're
for a
making a
few
request.
years.
Okay. All right.
Oh yeah, yeah. We actually completed an IRB request per DSHS's requirements to do this quite a while ago, and the request has just been delayed over time.
Thank you.
Sure.
All right, Manager Greenberg.
Yes, quickly. Mike, I do want to note what you said, that the board has established priorities for staff and a process for new, additional work or projects. And so, Manager Bell, I appreciate you pulling together that meeting. And I would just say, if we need to bring this before the executive committee, just let me know. Thank you.
Thank you, Chair Greenberg. I appreciate that. Okay. Any other questions or comments? If
Dr. Bell.
Who is
John Morgan.
Oh, John. There you go. Okay.
Hi, Dr. Bell. Good afternoon, members. I did want to just kind of prompt the committee one more time that when this dashboard is live, what we really wanted to show you today is the capability and what we can do with this type of dashboard. And Manager Jones, I think your question was a good one. It made me think to come back to this of if there are different views that the board is interested in, whether it's morbidity or mortality or other overlays. The nice thing about this tool and the work that Ashley and Sarita and JP have done is that we've got a platform now that we can pull our data into. So this is really going to become the primary tool for us to look at enrollment and services data. As Sarita mentioned earlier, this is still in development. We're still, checking all of the data and making sure that we have good explanations for where things have changed over time. Today, this dashboard does not include any utilization from our partners at Seton, so that'll be another future iteration. But if there are other views that you would like to see us build in over time, please send that feedback and we'll get it into the queue. This is going to continue to evolve for some time, and we're happy to take those requests into consideration.
Thank you, John. Appreciate that information. Okay. We will move forward to agenda item number 2, receive and discuss an update on communications and community engagement activities and initiatives, including COVID-19 response efforts and website upgrades. Ted Burton, Mike McKinnon, and Juan Turno of Cultural Strategies and Cassie Bunch of Belmont Ice House will be presenting.
Thank you, Manager Bell. Hi, everybody. This is Ted Burton. I'm Vice President of Communications for Central Health. We have a couple of presentations for you today. First, we want to provide you with a recap of our COVID-19 media, paid media that we've been using since about March of this year. And also following this presentation, Mike McKinnon will give you a preview of our new website, which we've been working on for several months now, and we'll be preparing to launch in the very near future. I'm going to share my screen. Can everybody see that? Great. So joining me for this presentation is Cassie Bunch. She's the media director for Belmont Ice House, one of the marketing and advertising agencies that we've had the pleasure of working with over the past few years. And Juan Turno, he is a partner and CMO at Cultural Strategies, and they are a longtime and trusted partner of Central Health. And so they'll be joining me for this, hopefully, brief presentation. I can make this move. There we go. So we began paid media back in March when the pandemic exploded and became a really serious health crisis, not just here in our community, but nationwide. The communication goals for the paid media, you can see them here, but we wanted to connect uninsured, low-income Travis County residents or recently unemployed residents due to COVID-19 to information regarding where to get tested, how to get tested, and how to protect themselves and their families, and then hopefully mitigate future COVID-19 positivity cases. So our communication goals, supporting the organization goals, we're really focused on educating high-risk Travis County residents, so Latinos, African Americans, and low-wage hourly workers, so they could understand how to protect themselves and their families and drive phone calls to Community Care's COVID-19 hotline and traffic to the Central Health COVID-19 landing page, which is a wealth of information thanks to our amazing team. All kinds of content, video content. I lose count. I think at this point we're probably in the 40s in terms of how many videos that we produced, English and Spanish, over the past several months. And so the diagram just shows you our overall goals: awareness, consideration, and conversion. And now I want to introduce Cassie Bunch, who's been the lead on our media planning and implementation from Belmont Ice House. Cassie.
Hi there, everybody. Yeah, so we have 4 main pillars within our strategy. The first is to utilize media channels that are most used by those with low income, who are uninsured and are also MAP patients. The second, we want to make sure that we're reaching them throughout their daily routine as they're consuming information on a variety of different platforms and through different vehicles. And then we also are focusing on media partners and types of media that provide strong coverage with our patient population, as well as having multiple capabilities. So that ultimately provides a more efficient and effective plan. And then last but not least, we have incorporated a pulsing strategy. So that's a combination of continuous media along with flighted media. So we are utilizing the dollars the most efficiently and effectively as possible as well.
So I mentioned the target audiences when we kicked off the presentation. We have approximately 10 priority zip codes in Eastern Travis County and the Runberg area. And we are targeting 18-year-olds and above with household incomes of less than $50,000. And again, our primary focus is on speakers, either people whose preferred language is Spanish or they're Spanish only, but they also speak English. I'm sorry, preferred Spanish but speak English or Spanish only, African Americans, and low-wage workers. And these are low-wage earners who are in some of the high-risk categories. So for example, construction workers, blue-collar workers, people who work in the service industry.
And as you can see this is a summary of the media delivery that we've implemented since March, and this actually runs until November. So we've invested a little over $300,000, but we've also gotten nearly 25 million impressions. And we've also received a little over 10,000 TV and radio spots that are in our plan. So you can see that with the various target audiences, we've really tried to make sure that we're reaching all of them effectively. So the low wage, if you look at the chart on the right side of your screen, we have the low wage workers that is around 32%. Spanish speakers are getting about 38% of that spend. And then African Americans are getting 26%. That general market is what you can see on the pie chart over on the left-hand side, that is SEM. So that is anybody in Travis County that are searching for more information on where they can go to get support and health.
And a list of the tactics are on the left side. So it's the media spend buy tactic. We can dive deeper into that if you like. And also Juan Torno is on the call, and Juan has been extremely helpful with us for our radio placement, helping us identify radio stations. All of this is based on media buying research tools. We're not just sitting in a room and guessing which stations we think people might want to hear. It's based on the media tactics and channels are based on the consumption and behavioral and lifestyles of the people that we're trying to reach.
Exactly, and this is Juan. We've dig extremely deep into all the research to assure that every single radio station that is chosen, it's targeting especially the target audience that Ted described.
And I wanted to add, some of you may be watching and saying, well, I haven't seen or heard any of the advertising. You probably have not, because it's been extremely targeted and focused on our patient population. And so unless you are in that population, you may, or you likely have not seen or heard the advertising. Cassie?
Yeah, and I was going to say to that point, we have a very focused geography on that, as well as Ted mentioned, the specifics of what makes up that patient population. So again, utilizing those syndicated research tools and really putting the science to it to see which media channels are ranking the highest and are priority for how our patient population is consuming their information. That's where we want to be, and that's where we have been.
And do you want to go through quickly just the list of the paid media?
Yeah, so over the course of the last 6-7 months, we have had some TVs. So, and Juan can speak to a little bit of that. We've had the town hall as well as the Univision segment. Do you want to speak to that one?
Yes, we organized several town halls on Univision that were live. We had professional medical folks or people from AISD representing the community, people from Central Health and other experts sharing with the community several things. One was talking about going back to school safely, how families could prepare to go back to school safely. Another was addressing how, what that is if you contact COVID, what to do afterwards, what options were available in the community to take care of yourself and your family under those circumstances. All this information for Spanish speakers.
Yeah. And then moving down the list, we've had traditional radio schedules that are targeting stations that their listenership is high among Spanish speakers as well as African Americans. And then we've also had streaming audio. Streaming audio would be your pure plays like Spotify, but that is the free version of Spotify. So it's not trying to reach people that have subscriptions. And then going into programmatic display and search. So that's just your digital banners that are being targeted, again, to those nuances of each of the individual targets. And then we've had social ads. So that's not only pushing that message out, but it's also helping to support the organic social media that Central Health is running. And then we've also had quite a few ads in print ads within The Villager and El Mundo, again, really making sure that we're focusing on that patient population. And then over on the side, over on this side, it just shows some added value. So what we try to do to maximize those dollars, whether it's over delivery of impressions, spots, or negotiating those rates down as far as we can get them.
This is an overarching media flow chart for the media that we've placed since March. I also want to point out that we've shared this flow chart with Austin Public Health. We work closely with their team. I'm on a weekly call with their communications team, and especially this late summer and early fall, they're also doing paid media, and we wanted to make sure that we're complementing each other's schedules and trying to be as efficient and as effective, getting as much bang for our buck as possible. So hopefully we're not competing for airtime, but we're complementing what they're doing and vice versa. I'm going to keep us moving, Cassie. Sorry.
Sure.
Juan, do you want to talk brief? I'm not going to actually show the town halls.
We just shared the details on this, but as you can see, it was an interactive. Folks were commenting, folks were asking, and it was extremely informative again. And as you can see there, it reconfirms that it was a live stream on Univision 62 website, app, and Facebook page. And 2 different programs that they actually afterwards continue living online. So people were still able to access this information, even though not live, but get all the information and action items that we were sharing with them to better address these 2 issues. Again, going back to school safely and what to do if you had contracted COVID.
Thank you, Juan. I know that we're short on time. You have these in your packets, but I'll just give you a little bit of eye candy to show you some of the advertisements that have been running. These are everything that we produce has been produced in English and Spanish. This is an example of a social media ad that was targeted at people who may have lost their job due to COVID-19. Another social media ad. This one was for the fall, late summer, fall, understanding that people may have been sort of exhausted with COVID-19. We wanted to reinforce that now's not the time to let down your guard, especially with people returning to work and students and teachers and workers returning to school classrooms and campuses. Again, a social media example, we really pushed the 3 W's: wear a mask, wash your hands, watch your distance. And we have the 3 M's in Spanish that Juan helped us create. And then just some examples of display banners. So these are ones that run online. Perhaps you're searching for a place to get tested, information on COVID-19, what are the symptoms? These are some of the ads that you would have seen. Medical appointments by phone, when community care quickly pivoted and began offering more telephone, telehealth, telemedicine calls for patients. We wanted to push that out as quickly as we could. And this is the COVID-19 testing. So we really wanted to push, if you were to click through, you would find testing locations, requirements, and times, etc. And then protect yourself, protect your family. We created this with its own separate look and feel, and have been pushing that out in English and Spanish, just encouraging people to take whatever means necessary to protect themselves, their family, and their community. Another example of what's running now: we've come too far to let down our guard, stay safe from COVID-19. An example of the print ad that it's run in the Villager: COVID-19 symptoms have been exposed, take these steps, call the hotline. And then we've also done direct mail, working with community care. So they have established patient lists that we've used to send out a series of 4 different postcards, 4 different mailings, each with a different theme. They're English and Spanish, and so I won't read them to you, but you can see ways to get tested and access care, wearing a mask, and this is actually the grandfather of one of our star colleagues here at Central Health. If you have COVID, here are some of the COVID symptoms, and then the hotline number to call to get information. And then protect yourself, protect your family, the 3 W's, the 3 M's. We sent out 4 mailings to 38,000 households each time, MAP members and people below 200% of the federal poverty level, to the top 10 zip codes where our MAP members live. And finally, I had some examples of radio, but I'm not going to show it to you right. Play it for you now only because of time, and this is a PDF and I can't click through it. But anyhow, the radio spots we're focusing that are running now focus on flu vaccines and COVID-19, that this could be a perfect storm of these 2 viruses in our community. So it's really critical that you get vaccinated for the flu and continue taking every safety precaution to prevent the spread of both viruses. And with that, I'm going to take a breath and pause in case anybody has any questions, and I'll stop sharing my screen.
Thank you very much, Ted. That was extremely informative, and I appreciate all the work that you and your staff have done, and our consultants for getting the word out there to the people that we serve. It is so important, especially during this period of time, for us to be able to reach out and provide the appropriate information for the members that we serve. So thank you. Manager Valadez, I saw your hand.
Yes, and again, reiterating the theme that I've got for this meeting, you know, I keep hearing our existing map, but our mission is also to look at those that are uninsured, and many of which, thousands of which I believe are actually MAP eligible or MAP basic eligible. And I want to make sure we don't lose sight of that and don't forget that we need to include them in our high prioritization. And so somehow or another, we're going to have to come to terms to what the board has adopted. If it in fact does exclude them, I don't know that it does. I think that they're aligned, but I want to make sure that we understand, or that Central Health understands that that is our mission. And so it's not just reiterating to the MAP people, but also to the people who are MAP eligible, not enrolled and not receiving services. So, you know, that's always been my concern since I got on this board, and that's something that I still want us to not lose sight of. Thank you.
Thank you, Manager Valadez. Any other comments or questions? I am not seeing any. Thank you again, Ted, and your co-presenters for the fantastic work that you've done. I appreciate it.
Thank you.
I'm sorry, did you?
No, I said thank you very much.
Oh, okay. Agenda item number 3, receive and discuss an update on the Central Health Equity Policy Council fiscal year 2020 and fiscal year 2021 plans. Megan Cermak will be presenting.
Thank you. This is Megan Cermak. I am the lead on the Central Health Equity Policy Council. Can everyone see my screen?
Yes, I can.
Oh, okay, great. Let me make sure I'm in slideshow mode. Here we go. So the last time I was in front of the Strategic Planning Committee, I was updating the board members on the fact that the Central Health Equity Policy Council had decided to move beyond our 4 policy indicators, which had previously been tobacco, obesity, diabetes, and HIV. We had undergone an extensive process of reviewing all community reports. This involved 1,500 volunteer hours, and that was to identify our calendar year 2020 policy initiative. That initiative ended up being a partnership with the Human Rights Campaign to pursue the Healthcare Equality Index initiative. In summary, this was a set of policies and procedures that we were going to promote within the safety net system that would produce more equitable outcomes for our LGBTQ patients. We were really excited about this campaign because we were also going to be a national pilot for the inclusion of intersex policies and procedures. There was so much work that went into deciding this initiative for 2020. And then of course, in March, as we all know, everything kind of came to a screeching halt. There was staff that were flying out from DC, from the Human Rights Campaign, to help us kick off this initiative here locally. And so even at the Human Rights Campaign at the national level, we're seeing that this work is being put on pause temporarily, as well as locally, until the healthcare system, as they continue to respond to COVID and in the future rebuild themselves. I do not see us picking this initiative back up until at least 2022. It took us a second for us to get our feet beneath us at the Central Health Equity Policy Council and figure out what is our path forward in this weird COVID world. But we did finally carve out our work for us. We have 4 kind of buckets of work that I'm going to be presenting to you. The first started off with an internal conversation about what are our policy opportunities to address pandemic equity. After some deliberations, we kind of decided that we wanted to research, are there policy opportunities in regards to funding for disaster preparedness, transparency in how funding is allocated in times of disasters, and specifically, how is the safety net prioritized in disasters, and what is our role and responsibility, and are we resourced appropriately with disaster dollars? So we're going to be calling on the Central Health Equity Policy Council to help us research what these policy opportunities are. But in the meantime, we've connected with the Texas Association of Community Health Centers, TAC, and bullet points 3 and 4 are also on their agenda coming into this legislative session. So we're going to be working together to figure out, is there a bill this session that can help prioritize the safety net in a disaster, figure out its exact role, and make sure that it's resourced appropriately. We have done some quick tabletop research on this and some informal interviews. So preliminarily, we're seeing that most disaster funding is kind of designated and allocated at a federal level. So there may not be a state or local opportunity for policy in regards to funding allocation. But where we are seeing some possibility is making sure that the safety net has a seat at the table at these disaster planning councils. And so we can carve out our own roles and responsibility during a disaster and then make sure that we're resourced appropriately. And if not through funding dollars, at least through things like the national stockpile, which we saw during the beginning of COVID, we had no access to. We have been convening some focus groups with the Central Health Equity Policy Council and some informal interviews to see if this is an interest of the council and or the agencies that they represent. So preliminarily, this is what we're hearing. Everybody, including Central Health, Community Care, and then the Policy Council, everyone has their eye on how data is collected and prioritized during a disaster. In Travis County, it took us about almost a month before we started reporting out demographic data in regards to testing and positivity rates. And that was a huge miss. So, kudos to Community Care, because they were the ones who identified this and started, pulling back data and then reporting out demographic data in regards to positivity rates. And they were the first ones to identify the populations that were disproportionately affected by COVID. So we're trying to see if there's a policy opportunity to make sure that there's never that miss again. How can we prioritize data as disaster response efforts are being stood up? There's also policy interest and a concern that we all share regarding people not accessing critical health services and preventative services, and what the backslide in health issues and health outcomes we're going to see as a result of that. Interest in social services. We interviewed at Central Health. We interviewed some community care frontline staff, Central Health frontline staff, and the community health workers that we've been working with. And one theme that we heard throughout the interviews is that if you didn't have a car to get to your doctor's appointment pre-COVID, that issue is not solved. You are not going to have transportation to get to a testing site. And that, that goes with food, that goes along, a spectrum of services. So is there a policy opportunity to guarantee more seamless transition and connection to social services? And then the final policy area of interest and opportunity is in telehealth and telemedicine. There is a lot of interest in this specific area, and especially going into this next legislative session. Just some anecdotes that I'd like to share with you. We heard from HMA that women who live along the border now have greater access to women's health services because of telehealth and telemedicine opportunities coming online. We heard from the Asian American Resource Center that within their network, it's being reported greater access to culturally competent mental health providers, because now more mental health providers are participating in telehealth and telemedicine, and insurance companies are waiving copays. So more to come. I have a feeling that you're going to see a lot of grassroots advocacy and support this legislative session in this telehealth medicine area, and seeing if there's something that we can do locally. So moving forward, we're going to convene a committee to continue to explore these issues and policy areas in regards to pandemic equity and more broadly in disaster response. And then, so in the past couple of years, the CHEP Council has been steering more towards clinical policy. We realize that is, one of our greater strengths. So, it's going to be some time before the healthcare system is ready to re-engage with us and looking at different areas of policy opportunities. So what can we do in the meantime to help the healthcare system rebuild itself? And while it's rebuilding, figuring out a way to plug in some policies regarding equity. So more to come on that. We haven't even kicked off this committee yet. As we were talking about pandemic equity, I wanted to share this very poignant quote from one of our policy council members. It became very clear that you cannot talk about pandemic equity separately from race equity. You can't talk about health disparities separately from racial disparities. And so the conversation started that anything we do in the pandemic equity space should have a racial lens, racial equity lens applied to it. And then the conversation blew up from there is instead of just applying this racial equity lens to pandemic policies, why don't we apply a race equity lens to everything that the Central Health Equity Policy Council does? So we're really excited about the second bucket of work, which is to convene a racial equity committee. Essentially what we're going to do is develop a set of prominent criteria to look at whenever we are analyzing policies or doing policy evaluation work. And that will be applied to any sort of policy that we consider the CHEP Council pursuing or supporting. We're putting a big stake in the ground here on this work. For the first time in its history of the Policy Council, we've been, we launched in 2015. We're actually going to hire somebody to help us with this work. Up until this point, it's been very community action driven, all volunteer hour driven. But we feel like we need some help in this space. So we're going to hire somebody to lead the research committee in this work. We're hoping to use a two-prong approach. The first is what's called the community-based participatory research method, so CBPR. And what it does is brings community members and researchers to the table together. Together, they define the research question. And in this case, together, they will come up with this evaluation criteria that we will apply to all of our policy analysis. The aim of this work is to make sure that all participants are heard equitably and that the process isn't really complete. The deliverable won't be done until everybody is happy with it. The other kind of prong in this work is to use research-driven identification of best practices. This is something that the Policy Council is good at. We're always reaching out to our partners at the Robert Wood Johnson Foundation, the Southern Poverty Law Institute, CPPP, to see if internally they have some sort of evaluation criteria regarding race that they use for their own internal policy analysis and evaluation. We'll bring those tools, those evaluation criteria back to the CBPR committee to see if they like it, if they want to modify it, for Austin needs, or if they don't like it, they can scrap it and continue to come up with their own. And as I mentioned, this work is being led by a consultant. And then the committee, because the Policy Council is taking this direction of clinical policy, I would really like to have the safety net patients at the table at the CBPR committee, along with any community member who wants to participate. And it's going to be a big ask. It's going to be probably at least a year-long project. And I think that's a big ask of our patients. So if we can't have a good mix of patients, I'd at the very least like to have a good mix of community health workers there. And together, everyone will develop the race equity criteria. I'd like to bring, once the criteria is complete, I'd like it to bring it back to the full Policy Council. So everybody's aware of the process that was, undergone, the findings throughout the process. And then, understand that everyone understands that this race equity criteria will be applied to all of our policy analysis moving forward. And I hope that if everybody likes the product, that they're going to bring it back to their own internal institutions for their own policy work. I think if done right, that this work is going to take every bit of a year. There's so much energy and enthusiasm at this moment that, optimistic timeline would be 6 months. I'm not in a rush to complete this work because I think that going through the process of developing this criteria will be just as meaningful as the final product. I want to assure the Board of Managers that race equity has always been, at the forefront and under the consideration of the Policy Council. It's always been in our work. When we launched in 2015, we did so with the 4 policy areas of obesity, tobacco, HIV, and diabetes, because we knew there were significant racial disparities and health disparities in those 4 kind of indicator areas. And so subsequently, we had hoped that any policy work we did to help achieve, close the gap on those health disparities would also help with some sort of race equity work. In our policy evaluation tool, we also had a subsequent question about equity, but not race equity. And so that is a gap that I'm addressing and I want closed now. Let's see, so I want to show you, I did an audit of our previous policy analysis of the campaigns that we either pursued or were under consideration for pursuing. And there was always, at least some sort of disaggregated data and some sort of like race equity work that went into our policy analysis. But it wasn't always complete. So I want to show you an area that we fell short. There was a gap, and that will not happen moving forward. From our recess policy initiative, we relied really heavily on this one specific data point at the top of the slide about access to daily recess and the difference in AISD between Title I and non-Title I schools. We do not have the racial breakdown for this specific data point. And I apologize, it was in 2016 that we did this research. I do remember making the ask of Austin ISD. I do not remember why we couldn't get that data point. But I will say, if I had to do this campaign all over again, I would have made sure to ask the question in several different ways. I would have made sure to bring in my policy council members from their separate institutions, so AISD received the request from a lot of different partners and not just one. If I couldn't get it from AISD, I would ask TEA or Children's Optimal Health. I would produce my own sample and get the data ourselves. I am personally receiving a lot of mentorship in this space, and I'm learning that disaggregated data has to be a pillar moving forward in race equity work. And so that is at least one way that we're going to improve moving forward. The second is making sure that we have lived experience at the table during the research process. We've done a pretty good job of making sure that we have the community voice in our grassroots advocacy work and when we create our communication materials for each campaign, but it's not been at the table during the research process. I'd like to quickly share one anecdote with you that it was a huge miss for us. When I was working on the recess campaign, I was meeting with the Manor principal, and he had a son in the 2nd grade who had behavioral problems and was consistently getting recess time taken away from him. And after our conversation about, how closely physical health is tied with behavioral health, mental health, academic performance, it was a pivotal point in the campaign. And something that he said to me that I wish I would have, had a microphone for was, he had consistently been punishing his son and saying, you can't be hyper and Black. And so I want to make sure that those stories are brought to the table during the policy selection process. As a result, that principal was the one who got the recess policy on the agenda for the school board. So, there was good work that was done there, but it could have been better, and it will be better moving forward. Okay, really quickly, I'm cognizant of time here. I'm going to breeze through the next couple slides. Our policy council is getting ready for the next legislative session. We, of course, will be tracking bills of interest. We will also be activating our network when there are opportunities for advocacy where it makes sense. We have not formed our legislative committee. These are not our formal legislative priorities as of yet, but this is anecdotally what I'm hearing our policy council members are interested in, and where it aligns with Central Health's upcoming legislative session policy priorities. Our next steps, we are having a full policy council meeting next week on October 21st. At this full council meeting, we'll request membership for our 3 committees that we'll be convening, the research committee regarding pandemic equity, the legislative session committee, and then our race equity committee. And then we'll also be releasing a request for proposals for that race equity consultant that I mentioned earlier. I hope to launch the race equity committee in January. And then my final slide is in regards to an exciting new partnership that we're going to be working on this spring. Many of you, I'm sure, know Dr. Virginia Brown. She works over at Dell Medical School in Population Health and has a joint appointment with the Department of Psychiatry. She just received a large grant to work on something called patient-centered, well, from an institute, the Patient-Centered Outcomes Research Institute. She will be launching the Collaborative Council for Mental Health this spring. And essentially what it does is bring patients and researchers to the table to identify new service lines and programs for mental health at Dell Medical School. And she's invited us to the table to listen to those conversations and hopefully tease out some policy initiatives that the Policy Council could potentially lead in the future. That is my final slide. So with that, I will take questions.
Thank you very much, Megan. That was an excellent presentation and a lot of useful information. Manager Valadez, I see your hand.
We still have the screen up.
Oh, should I stop sharing? I apologize.
Thank you. Thank you. Thank you very much, Megan. I appreciated that. One of the things that I wanted to know with respect to you using the term racial equity, are we only talking about black-white issues, or are we talking about ethnicity also? And the reason well, then it should be racial and ethnicity or language, something, because just because we have race doesn't necessarily mean Latinos are included or Asian Americans are included. Well, maybe Asian Americans, but Latinos, they don't ever know what to do with us. And one of my biggest concerns is that I think that there's a big bias against language. If you're not an English speaker here in the United States, I have gone through many, many state and national campaigns where they have tried to do English only. And I think that's one of the problems and contributors to our exclusion from participating in the various systems. So if you can please let me know that. And one more thing, I couldn't read the print of members of the Equity Council, but I would like to know whether or not we had any community members as opposed to representatives of people who are going because they represent an agency or an entity. That's not necessarily representative of our demographic, especially those that are most affected. Thank you.
Thank you, Manager. Megan, did you want to address any of those at this time, or?
Sure. Well, I want to thank you for pointing that out, Manager Valadez. Also, I will be sure to resend you the document and see if I can fix the print so that you can see the full roster. And at this time, we have about, I think, 70 members, and 10 are community volunteers that have no affiliation with an entity, but that we can do better.
Well, demographically representative is appropriate.
Okay, thank you.
Thank you.
And with respect to I didn't quite hear you, with respect to the racial and ethnicity and language question.
Oh, I thanked you for pointing that out. I used the term Race Equity Committee for brevity, and that's not appropriate. I need to fix that.
If you can, please. And language also is a big concern.
Absolutely.
Thank you.
Manager Jones, did you have your hand up?
Yeah, I just have a real quick question. Is it possible I could get the budget office to give me a profile of how much money we spend on our equity council?
Mr. Giesman?
Yes, I mean, Megan, off the top of your head, do you know what the budgeted amount is?
About $150,000.
That includes operations as well as staff, supplies, equipment, everything?
Yes.
Okay, thank you.
Okay. Manager Greenberg, did I see your hand, or?
Just quickly, Megan, I wanted to thank you for that very thorough presentation and for your recognition of where we have been, where we are, and where we need to go. And the fact that we need to, of course, be inclusive of all in our community. Thank you.
That's right.
All right. Seeing no more questions, I've done it again. Mike McKinnon was supposed to speak at the end of the last agenda item. And of course, I breezed on until the next agenda item. And so I do apologize, Mike. It is like 2 minutes before we're ready to sort of cut out, and I do not want to shortchange your presentation. So if you can bring back that presentation for the next strategic planning committee, I promise you it will be first on the agenda and we will see it. Again, my apologies for trying to be a little bit too efficient. My next agenda item is number 5, receive a report from the Eastern Crescent Subcommittee and take appropriate action on items discussed during the October 14, 2020 Subcommittee meeting. Chair Jones, I don't think there are any motions coming from your committee, but if there are?
There are no motions. You're correct. That's correct.
Okay. Thank you very much, sir. And finally, agenda item 6, confirm the next strategic planning committee meeting date, time, and location. Managers, our next regularly scheduled Central Health Strategic Planning Committee meeting is tentatively scheduled for Wednesday, November the 11th at 2020 at 1 p.m. or following the Eastern Crescent Subcommittee meeting at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment. Manager Greenberg?
I move adjournment.
Manager Valadez seconds. Any nays? Good. We adjourn. Thank you very much. Appreciate it.
Thank you, members.
Thank you.
Thank you, guests.
Thank you very much.